Here we are this morning in the village of Villa Paraíso. We have clinic today. We have over 50 patients today. It's Tuesday, and we expect the same on Thursday and Friday. It's always a blessing for us to come here. There's so many people in need of medical help, and it's a blessing to us. Thanks to God, we have the provision to do that. Let's go inside and see what's going on. We have 4 days of clinics each week, and every week we see over 150 patients, ranging from the common cold to cholera, typhoid, sometimes cancer. And when we get patients, it doesn't really matter to us what their problem is. We are going to help them the best way we can. The Lord has blessed us with a wonderful staff. Dr. Lambert has a reputation of being a very good doctor, and the people come to our clinics because they know we are going to give them respect. We are always trying to love them with the love of Jesus Christ. That's our main objective. And this is a way that we can tangibly evangelize to all of our patients.
Tina and Robert, we are working together and to provide medication, medical attendance to the people. And today it's a big pleasure for us. Here we can see more 60 patients, 50 patients in one day, with different kind of diseases. We have two different kind of patients. We have the poor Dominican people and we have the Haitian people. The Haitian people, they have much problem because much of them, they don't have any document and they cannot go to visit public health. They ask for a document and they don't have any document. They come to see us, they don't need any document, and we provide a medical attendance to them and we help them.
Me encuentro bien, gracias a Dios, que viene muy enferma y gracias a Dios y a ustedes me ha sanado.
She says she's very grateful to the Lord that she was sick before, and she's very grateful to us and the Lord that now she feels well.
Y que el Señor los siga bendiciendo para que sigan viniendo.
She says if the Lord allows that it continues, she hopes that it continues. Muchas gracias.
Doy gracias a Dios y siempre oro por esta clínica para que el Señor le bendiga.
She always prays for this clinic. She hopes that the Lord blesses it.
En especial en mi caso, uso una pastilla muy cara para el corazón, pero
in her case, she has to buy a pill very expensive for her heart,
que no puedo comprarla,
but now she doesn't have to buy it
pero aquí me la regalan.
because we give it to her as a gift.
Así que Dios le bendiga y siempre le supla.
She says God bless you and that the Lord always blesses you. One of the main things that we're proud of is that we are able to help these people live a more productive life, to feel better, to be able to go out and work, to be able to go to school, to be able to take care of their families. Because if you have a chronic illness and you're not receiving the medication or taking the medication that you need, you just don't feel like doing those things. So we give all the praise to God that we are able to do that for our patients. And as you see in the testimonies from our patients, they're very happy and very appreciative for the things that we're able to help them do.
I've been living here for 21 years, and it was we were going through a very hard situation. So when we had someone sick, we had to carry them down far away to the hospital. Because if someone has no money, there's no way for you to go to the hospital. So now, this is God helping us. This is how we see it. That brought you to come and bring this clinic to us. This is a huge blessing from God. This is a thing. This is a great victory for us to have this clinic.
In this village, Chichigua, when I came upon this village in 2008, the people were very sick here. And every time my wife and I, Tina, would come here to visit, there would be kids all over the village with sores on their arms, their head, their butts, their legs, everywhere. And we were like, why? Why are they always sick? And it was because the only water source they had here was to buy water from a water truck, which you can see that not many of them can afford to buy much of anything. Or they were going over there, there's like a little water that comes out of the ground, and it's very dirty. One trip costs about $15, and it lasts the people 3 to 4 days. There's about 65 families living here. They're each allowed about 4 to 5 5-gallon buckets full of water a day. They ration this themselves. They've been very appreciative of the water supply that we've been giving them. Thanks to God, we still have support, and we still keep supplying the village with water. One of the main things that we do is we help beautiful communities have churches. And here in the background you can see one of the churches that we've been working on here in a village called La Bahia. And this church is a church that we partnered with because they are doing the work. They are evangelizing their community, and they just needed help building their church. So here we are in La Bahia. We're with the Pastora, and we're being led around the community to visit with people that need prayer. And we're just praying for people. There's lots of needs here, lots of emotional needs, lots of physical needs, lots of spiritual needs. And we're just here to try and offer up prayer, hoping that God's Spirit moves through us and into these people. This is like the most important thing we'll do all week long. If you are considering taking a mission trip, or maybe you're not considering taking a mission trip, I want to ask you to consider taking a mission trip with Willing Servant Ministries here in the Dominican Republic. You are going to come and you are going to spread the gospel, you're going to help the poor, and you're going to bless local ministries, but also guaranteed the group is going to grow in their faith, and they're going to receive a blessing as well. We invite you, and we pray and hope that you'll come to see us real soon. God bless you.